Hi everybody, Stephen Green here, Ignite Volleyball Club. I'm really excited to introduce our webinar for tonight. We've got KRISTIN BIGNELL from Instill Physio. Instill Physio is a partner of Ignite Volleyball, so we want our athletes to be treated by the people who know and understand volleyball and injuries and how to prevent it and stuff like that. So tonight KRISTIN's going to be talking about the shoulder, and it starts with some great context around it. The title of the webinar is Building Resilient Athletes, Performance Optimization and Injury Prevention for the Shoulder. Okay, so she's going to go through a whole bunch of details, great Q&A at the end, and really good for athletes, parents, coaches, everyone who wants to know more about it. Okay, without further ado, here we go with KRISTIN.
Tonight we're going to be talking all about the shoulder and how to keep your athletes pain-free and functioning optimally. So my name's KRISTIN, as Stephen introduced. I'm a registered physiotherapist at Instill Physio, which is in Guelph, Ontario. I'm also a neurofunctional acupuncture and sports performance practitioner. I completed my undergrad degree at the University at Buffalo, where I also played Division I volleyball. I then went to the University of Toronto and did my Master's of Physical Therapy. And then since starting practicing, I've done some coursework at McMaster University in contemporary medical acupuncture. So today what we're going to do, we're going to go through some basic pain science. We're going to talk about the anatomy of the shoulder, what a healthy shoulder looks like, signs of dysfunction, and then how we can build resilience in our athletes. And we're also going to talk about neurofunctional screening, which is probably a topic that's new to most people, but it's a very important one, and something that I think is very important for people to know about, and a very powerful, a powerful sort of thing that we can bring to our athletes. So as a disclaimer, please do not try and use this information to diagnose or treat your athletes. It's not meant to substitute individualized advice. That's basically what that's saying. So in preparing for this presentation, I thought it would be good to look up some actual statistics. So there were a few different observational studies that I found. Two of them were done on NCAA volleyball players, and then the other one was done on youth volleyball players in Puerto Rico. And so what those studies found, left side hitters were comprised most of the injured athletes, followed by middle blockers, then liberos and setters, and right side hitters. Acute ligament sprains and muscle strains were the most common types of injury. Roughly 30% of the injuries observed were classified as overuse, meaning that they weren't attributed to a single identifiable event. And shoulder tendonitis or tendinopathy was the most frequent overuse injury in youth volleyball players. And understanding overuse injuries is very important because they are the ones that are most modifiable. So we're going to talk a bit more about that. And so I think it's really important, especially when we're talking about overuse injuries, to talk a bit about what pain is and what it means, because most of us don't really have a good idea. And I think it's very relevant, especially when we're looking at overuse injuries. So the International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So these are the different dimensions of pain. So pain is not only sort of what we think of sensory-wise, but there are emotional, cognitive, developmental, behavioral, and cultural components to how someone experiences pain. And these are a few key points about pain, again, from the International Association for the Study of Pain. So one, pain does not provide a measure of the state of the tissues. It's modulated by many factors, which we just discussed. The relationship between pain and the state of the tissues becomes less predictable as pain persists. So pain does not equal tissue damage, and that's not to say that it's not important or relevant, but it's a very empowering thing to learn because it means that we are not at the mercy of our tissues, and there are many things that we can do to improve pain. So this is the shoulder region. So this would be the front, and then this would be the back of the shoulder. So there are 4 different articulations. There is the joint formed between the humerus or the arm bone and the scapula or the shoulder blade, and that is the glenohumeral joint. So that would be the joint that would be implicated in like a shoulder dislocation. Then at the, if we go to the top here, there is a joint formed between the clavicle or the collarbone and then the scapula or shoulder blade, and that is the acromioclavicular joint, which would be the joint that would be implicated in a shoulder separation. And then you have a joint between your collarbone and your sternum. And then the last articulation is not a true joint, but it is the articulation between your shoulder blade and your thorax, and that is predominantly held in place by the musculature. And so the shoulder joint has a large amount of movement, and because of that, it relies on the musculature to support the joints. So this is the deepest layer of muscles. The muscles that attach the humerus, your arm bone, to your scapula. There are 4 main ones, and they're called your rotator cuff collectively. And the function of those is to hold the head of your humerus into the socket, and they keep it centered and in an optimal position. The more superficial layer of muscles, these are the ones that most people tend to be more familiar with. There's your pecs, your deltoid, and then you have your trapezius. And I think the most commonly underestimated part of the shoulder is the nerves and the blood vessels. So the blood vessels provide nutrients to the joints and the surrounding soft tissues, and those are very important in tissue health and tissue repair. And then you have the nerves, and so the nerves carry sensory information from the periphery to your brain. And they also carry signals from your spinal cord to your muscles to produce movement. And so both of those are very important when we talk about function, pain problems, and overuse injuries. So what does a healthy shoulder look like? So a healthy shoulder should be pain-free, pretty obvious. So there shouldn't be pain before, during, or after sport. There can be some muscle soreness if there has been a change in routine or an increase in intensity, but it shouldn't be something that's predictable after every practice or every game. Generally, pain is not normal. There should be full range of motion. There should be good strength of each of those muscles that move the shoulder, and then each of the muscles that support the shoulder. Should be strong within all available ranges. This is really important because we shouldn't be just strengthening within the middle range, especially in volleyball players, because they are at times, or most of the time in their sport, required to be in extended positions. And so they should have good strength in those positions as well. They should have good neuromotor recruitment of all the muscles, and so that means there should be a clean and efficient signal from the nerve to the muscles. They should also, or they would also, have good core strength and coordination. Oftentimes, shoulder issues can be a manifestation of poor core recruitment, and it's just that the shoulder ends up taking the brunt of that. And they shouldn't have any untreated injuries. So even in the absence of pain, if someone has had an acute injury, there are likely to still be dysfunctional, or there is likely that they still have dysfunction in some of the nerves unless they've had those specifically assessed and treated. And we'll talk a little bit more about that in a minute. So signs of dysfunction, most obvious one would be pain, like we talked about. Limited range of motion. As coaches or parents, you might see an unexplained change in technique. They might have decreased speed of their arm swing or decreased power. And then how do we keep shoulders healthy? So how do we prevent dysfunction? We want to ensure proper warm up and cool down. And I'm going to expand on these shortly. Allow for adequate recovery time, encourage sports diversification, regular completion of a general strengthening program, and that would include strengthening for rotator cuff, scapular stabilizers, and core. As we talked about how core is important in shoulder function, especially in overhead athletes. Athletes should participate in regular screening examinations. So that would be a neurofunctional screening. So just to make sure that we aren't forgetting to look at the importance of the nerves and how the nerves are functioning. And we'll talk again later. I'll describe more about what that would look like. And then supporting those nerves or that system where needed. And then it should really be, there should always be a team approach when establishing training programs for athletes. And so that means coaches, strength and conditioning specialists, and then sports medicine practitioners should be working together in order to come up with a plan that's going to best support athletes. So warm up. So there's no recipe for warm up. It should be a combination of active range of motion, muscle activation exercises, and start slower and build up. You can start with isolated muscle activation in younger athletes and progress to more combined movements. I'm going to give you some examples of some exercises later. And those exercises can be used as part of a warm-up program. And there should be emphasis from a young age on training with intent during warm-up. So not just going through the motions, but making sure that they're paying attention to their form and being aware of what is happening and when in their body. So cool down, again, no recipe. This would be the time when you would do stretches. Recovery. So athletes should have optimal time or sufficient time between practices and games to allow for tissues to recover. In terms of overall volume, it's recommended that athletes don't participate in more hours of activity per week than their age in years, and that would max out at 16. So a 10-year-old should not be participating in more than 10 hours a week of activity. And that would include all of their training, their sports, their games, tournaments. If they are, there is a correlation with significantly higher injury rates. And youth athletes who do participate in more hours of sport per week than their age should be closely monitored for indicators of burnout, injury, and decreased performance. So sports diversity, this is another important topic. So specialization would be year-round training in a single sport at the exclusion of other sports. And sports diversification would be playing multiple sports. There's a correlation between early sports specialization and injury rate. Overuse injuries that do occur in specialized athletes also tend to be more serious. There are higher rates of burnout and dropout in specialized athletes. They are at higher risk for decreased performance due to overtraining. And for volleyball and other team sports in particular, the age of specialization recommended would be middle adolescence, so around ages 15 to 17. Then that would be an appropriate time for an athlete to start to specialize. And this is just based on some research studies that have been done. So here are some examples of shoulder exercises. So the first one, this one is a self-release for your infraspinatus, which is one of your rotator cuff muscles at the back of the shoulder. And when that muscle is really tight, you can end up with a trigger point in the muscle, and that will refer pain into the shoulder. And I would say the majority of my overhead athletes, whether they are volleyball players, swimmers, baseball players, have trigger points in their infraspinatus. So this is a good one to add as part of routine shoulder hygiene, I would say. And then for these exercises, there are many different exercises that can be done to strengthen the shoulder, and these exercises can be they could be done as either warm-up exercises, so they would be lighter resistance, they could do more repetitions, and the purpose is to warm up those muscles, or they could be done as strengthening exercises, so more challenging, less repetition, and then less frequently. So this one, shoulder stability is important because that will control the position of the shoulder blade, which you can think of as the anchor for the shoulder. So you want that to be nice and strong while you're at, for any sort of overhead movement. So these are just some examples of that. Scapular retractors, that's important for posture and, again, shoulder stability. Shoulder abductor activation, that will work your deltoid, your supraspinatus, and your upper traps. It's a good general exercise. Rotator cuff, very important. This is to work the external rotators, and so there are some different options there. This one shows an exercise that will work multiple different muscles. It's a little bit more challenging, and technique is very important for these. So I would say definitely have like either the strength and conditioning specialists or whoever is part of that athlete's rehab team make sure that they're advising the athlete on proper form. And yeah.
KRISTIN, can I ask a quick question on this? So
yeah,
I was just looking at some of these diagrams, and these look pretty much just like the ones that our teams do to warm up when they use their bands and stuff like that. So we have a lot of athletes that, I mean, as you know, you were a club athlete where they start at 8 a.m. and they finish at 10 p.m. Looking at these, is this something that the athlete should be doing before every single game? Is there any variation there? Can you comment just kind of on how often they should be doing some of these shoulder exercises as part of a tournament format?
So I think that so like I was saying, they could be you could be doing these either for the purpose of strengthening, so then that would be just like 2 or 3 times a week, but more challenging, so you'd be going to the point of fatigue. Or they can be done as warm-up, which these are, I know what your teams have done for warm-ups, and yes, these are the same essentially as what you have been doing. And I think they are good to do. So if you had a tournament, even doing just like 10 repetitions of not all 3 of these, but having maybe one exercise that kind of warms up each of the different muscles, and just doing even like 10 repetitions just to get things warmed up, but a very low level resistance. Like they shouldn't really feel fatigued after doing them. It should be something where it just feels warmer, and then they can go into their throwing drills and whatnot.
Awesome. Thank you.
Does that answer?
Yeah, perfect. Thank you.
Okay. So then these would be for the internal rotators, so rotator cuff in combination with some other muscles. And then the neurofunctional screening. So I talked a little bit earlier about how important the nervous system is. So it controls sensation and muscle activation. So a neurofunctional screen is a way of assessing the function of the nerves and their ability to conduct their signal efficiently to muscles, which is essential in maintaining optimal function and health. And so this is a way of detecting dysfunction in the nervous system, and it involves a specialized type of manual muscle testing to determine specifically which nerves and which muscles might not be firing optimally. And we can detect this in injured or athletes experiencing pain, as well as athletes before they start experiencing pain. So you can detect pretty significant dysfunction before an athlete starts to complain of pain, which is pretty cool. Because then what we can do is we can treat those specific nerves to improve function. And the way we do that is predominantly through acupuncture. So it's pain-free. I know some people get a little bit nervous about acupuncture, but we can do acupuncture on athletes of all different ages. And it's a precise nerve stimulation technique. It uses fine solid needles placed in precise locations with the goal of regulating activity in those nerves. So it restores balance in the nervous system. So if there are nociceptive signals, so nociception would be those unpleasant sensory signals that contribute to an athlete feeling pain, it will decrease those. And then it will also increase output to muscles that are inhibited. And that results in immediate real-time improvements in the recruitment of those muscles. So both sort of the graded recruitment of a muscle as well as the ability of that muscle to react quickly. It's not the same as traditional acupuncture, so it is different. A lot of the points are similar, but the way those points are chosen and the goals of the acupuncture placement is very different. And then we also use electrical stimulation because the nerves use electricity to conduct their signals. And so that's a way of rebooting the nervous system, if you will. And it's a very good tool. It's a very powerful tool, I would say, for maintaining or optimizing performance in athletes. It's a very good tool for treating injured athletes. And I've had a lot of personal as well as professional or clinical success with using the neurofunctional acupuncture. So managing the painful shoulder. So if an athlete does end up with pain, neurofunctional assessment and treatment should be part of that, should be part of the management. Cupping, other soft tissue injuries to help improve local circulation. They should have an individualized strengthening program to manage any imbalances in muscles. They should so focus on technique, which would be coaches would be responsible for that. Ensuring adequate recovery between games and practices, monitoring their serving, hitting reps, and again, requires a team approach. So the takeaways: shoulder injuries comprise the majority of overuse injuries in youth volleyball players. They are preventable if the right approach is taken. A team approach to athlete training and injury management is key in developing lifelong athletes. And never underestimate the role of the nervous system in function and performance. So if you have question, well, there is one question, but if you have any other questions, you can email myself or Steven. This is my email here. Or if you have anything you want to learn about in a future webinar, you can also email me. That would be great. Thank you.
Thank you very much, KRISTIN. That was awesome. It's important to kind of understand the background of all this stuff, because I think it's one thing to say my shoulder hurts, but then to kind of understand how it works, I think is really important. So I have a question. I've got a couple of questions as well from the audience. So my question as a coach is, can you define is not the right word, can you talk about as a coach what we need to look at or consider if an athlete says my shoulder is sore? So we don't have pain. They're not defining it as pain, but they're saying it's sore. What do we have to start to look at? Stuff like that.
So I think if it's like a one-time sort of thing, then that's okay. So if it was, there had been some sort of change, so you had either changed arm swing or they had a new like strength and conditioning program or that sort of thing, then that's okay. But generally pain is not normal. And so soreness is a sign that something is not optimal.
Something's about to go the wrong direction.
Yeah, and whether or not, so it could be even like, so, and that shoulder pain may go away, but it could end up being, it will eventually manifest somewhere.
Right. It's almost like you get thirsty before you become dehydrated,
Yeah.
like that sort of thing. Okay,
Yeah.
got it. Yeah, 'cause I mean,
And it's a lot easier to treat and to help someone when it's just sore. Like it could just be like you need to change one thing, or you need so if I see someone, if they were to come and see me, they would maybe just need one treatment and they'd be good to go. Whereas if the longer you let it go, the harder it is to yeah, change, because the longer you let it go, the more compensations are happening, because our bodies are very good at compensating, and so we're just going to keep adapting until we run out of compensation.
yeah, and you're exactly right, because I've seen that with athletes. You see it with ankles, right? So the
Yeah.
ankle hurts, and all of a sudden now their knee is sore, and
Yeah.
it's your body, it's protecting itself, but because you're not stopping it, it's getting worse. So
Yeah.
yeah, compensation's a big fear that we need to watch with our athletes. So
Yeah.
okay, so I got a couple of questions came in by email here. So this question is: could bicep pain be linked to shoulder overuse?
Yeah. So I would say that bicep pain would be one of the most common presentations of shoulder pain in overhead athletes. Um, so when we, I think going back to when I talked about what pain is and what pain means, just because there's pain in the region of the biceps doesn't mean there's a problem with the biceps. So it could be there could be many different things that contribute to that. So it could be overuse, it could be imbalances in different muscles. Um, yeah, it's there are so many different ways that can present in an athlete.
And do you see a lot of imbalance? I mean, that's a really key word, because I know when athletes, because one thing you talked about at the beginning of the webinar is not specializing, right? So you got some kids maybe who have biological strengths in soccer, and then others that may have biological strengths in lacrosse, and now they're trying volleyball. So they may have overdeveloped, if they were a basketball player, maybe they have an overdeveloped bicep, and now they're doing volleyball. Do you see a lot of that imbalance and that causing injury? Is that something that younger athletes, say between the age of 12 and 15, when they're deciding where to specialize, do you see that being an issue?
I think it has more to do um, more to do with like posture, I would say, in growing athletes. So you can get imbalances in like length and strength of different muscles, which would affect the actual position of the shoulder. And then if you're not in more of that optimal position, then things can't function optimally. Then there's also when we talk about neuromotor recruitment. So if you have specific nerves that are not conducting their signal efficiently to their respective muscle, you will have compensation because other muscles are going to have to pick up or carry the slack. So you might not see an actual like physical sort of imbalance, but in terms of what, like there's an imbalance in sharing of the load, let's say.
Yeah, I see
Does
what
that
you're
make
saying.
sense?
Yeah,
Yeah.
it does. Yeah, it does. It just creates an imbalance, right? It's
Yeah.
everything's got to make up for it, and now you got a whole other set of problems, right?
Mhm. Yeah.
Yeah. Okay, another question from the group. So, and this is probably more of a general question. Is weightlifting necessary for your volleyball players? So, the way I interpret that is, I mean, there's strength and conditioning, but I think more around. I'm gonna guess probably more closer to like bulking up sort of thing, or a little more heavier weights. But is that something do you think that's necessary for volleyball players?
I think it depends what they're referring to. I think strengthening is absolutely necessary. I think the way that it would depend on the way that it's done, because I think it should be done very differently depending on the sport. Absolutely you want to do some sort of strengthening. Really, like the strength and conditioning specialist would know that best and should be able to. So you shouldn't have like your gymnasts and your football players wouldn't be doing the same sort of strengthening routine, yet strengthening is going to be equally as important for both. I don't think I'm answering the question. I'm not sure, but
no, I understand what you're saying. Yeah, I mean, there's got to be it's got to be specific to the respective sports. So you're not going to have volleyball players bench pressing max weight with very few reps and maybe higher sets, but they're going to be more the endurance type strength and conditioning that they'd be looking at, right?
Yeah.
It's going to be particular to the sport. So do you notice, I don't know if you would know off the top of your head, I'm sure you don't have any stat behind this, but do you notice that less people that the people that you treat are generally the ones that maybe don't have a regular strength and conditioning program?
I would say so. I think the population that I work with is mostly athletes, and I think most competitive athletes now have some sort of strength and conditioning program. So I don't know if it's representative of what the population would be like as a whole. Probably, like, I think, yeah, probably that those that aren't doing some sort of formal strength and conditioning would have more, but the ones that I'm seeing are doing some sort of strength and conditioning program, and then they might just need recommendations as to how to modify to better suit their needs. But
one more question. I don't know if it'll be the last, because I think it's some of the stuff that you're kind of answering with. It's creating some really good thought and some more questions around making it making the environment optimal for the athlete. One slide you were showing there was around the number of hours active per week, okay? And I believe you said if they're 10 years old, then they should be active 10 hours a week. So if we're talking now, first of all, was that specific to the shoulder or just gameplay? No. What was that?
It's for overuse injuries. So the hours of activity per week should not exceed the age of the athlete in years. So like a 10-year-old shouldn't be participating in more than 10 hours, 11, no more than 11 hours, but it maxes out at 16. So like a 17-year-old shouldn't be participating in more than 16. And I know that happens a lot, but the research just shows that if you do exceed that, then you're at a greater risk for overuse injuries. And usually, so if you specialize and if you're participating in that many hours of activity, then your overuse injuries tend to be more severe or serious.
Okay. How many and specific to volleyball, how many? Good gosh, I know now, like with our club, we monitor jumps, right? So we've got the verts going. We know how many times the kids are jumping, and we monitor that. Like,
okay.
How many swings are, let's say in the age category of anywhere between, say, 14U and 17U, kind of in that middle. They're not quite beginners, but they're not getting ready to go off to college and university. Is there an optimal number of swings on the ball? Because I can imagine there's got to be.
I don't know. I'm not aware of research that's looked into that. That would be a good thing to look into, because I know they have that for like baseball, for young baseball pitchers, right? So
yeah,
I don't know if anyone's looked at it.
You would assume if they were jumping, they're swinging at a ball. So I guess you can put that together.
Yeah.
But
how do you pick number of jumps?
We'll look at their overall load for the week. So what we would do is, let's say we're going Sunday, Tuesday, Thursday practice, and we know they have a tournament on Saturday. if we know that we're in the heat of high school season concurrently, and we know they just played that day, we would make a hypothesis, we'll say, that they probably jumped in their game if they're a key athlete, which most of our club athletes are key to their high school or their whatever school team. They probably already jumped in excess of 100 times. So we're going to say approximately for tonight, because they've already done enough jumping, we're going to say 50 max tonight, and then you're done jumping. So to answer your question, I think we look at what they've done and then determine it, but I think it also depends on what their workload has been that week. We know that in a match, they're probably jumping, not including warm-up, they're probably jumping in and around, I believe the number was, middles are as high as 60 to 70 a match. Jump servers are more, middle blockers are more. So it comes down to kind of how much you think the athlete can handle based on what they've done and their position. Very general, broad answer, but all those things are taken into consideration. If we know a kid didn't have a high school game that day on a practice day, and they have nothing going, they have an off day and then a game on the Saturday, then we might let them jump 125 times, right? So it's hit and miss in the sense that athlete, conditions, history, and then of course what their next 2 days look like. So yeah, that's how we do it. There's a nice complicated answer for you. So okay, awesome. I'm just going to double check, make sure we have no more questions that came in here. Bear with me, and we don't. All right, cool.
All right.
Hey, KRISTIN, thanks so much. That was awesome. Some great context there. And of course, this is recorded. So if anyone wants to kind of come back and have a look at it, there's some pretty cool pictures there too. I've got to say, it's one of the cooler presentations I've seen. So, but thank you very much. I know Instill Physio is definitely a partner with Ignite. So, you know, if we have any athletes or parents even that need any work done, then, you know, you're definitely, you're a go-to person because you played volleyball and you know what it's like, and you know what the conditions are all about, and of course the club scene as well. So thank you very much for that. That was fantastic.
Thank you.
Yeah. Okay, everyone else that's on the webinar, so this will be available to you within the next day or so, exclusive if you did register for the next week, and then we'll open it up to everybody after that. And until next time, we'll talk to you soon. Go Ignite.
Bye.